Welcome, and thank you for joining us today. At Patient Payment Solutions, our goal is to get you paid, but the only way to do that is for you to use the system. And that is why we're doing this training today. We want you to feel comfortable offering payment plans to your patients and also why you are offering payment plans to your patients. It is important for you to understand that by offering payment plans, you are offering a tremendous benefit, something that in my opinion all providers should be doing, but many are not. Today I would like to reiterate why you signed up with Patient Payment Solutions and why your patients are going to be so grateful to you for offering the PPS payment plans. Let's begin. Our mission at PPS is to assist healthcare professionals in collecting more money by providing effective payment options that increase new patient case acceptance and decrease write-offs from bad debt. By doing this, you will be able to stabilize your monthly revenues and ultimately collect more money. However, the only way to do this is for providers to feel comfortable with the PPS system and actually propose payment plans to their patients on a regular basis. Let's start with the various reasons for offering payment plans to your patients. The first and most obvious reason is to make your care more affordable to patients, which leads to increased case acceptance. Let me ask you this: what is even more important than having new patients come to your office? The answer is new patients that stay in your office. I know some of you are doing a whole lot of marketing and spending a lot of money to bring in new patients. If those people can't afford your services or don't accept your proposed treatment plans, then a great portion of your marketing dollars are going to waste. Offering payment plans will remove the financial barriers for patients and allow more new patients to accept your care. This will significantly improve your return on investment for your marketing dollars. Another reason for payment plans is to become less dependent on insurance companies. For example, insurance may limit the number of visits or dollar amount per year. What do? Do you propose a treatment plan based on coverage, or do you propose a treatment plan based on what is best for the patient? Well, by offering payment plans, the patient's out-of-pocket responsibilities can be spaced out over months. This can greatly increase patient retention. And I know a lot of you have heard this before, but it is much easier to keep an established patient than it is to obtain a new patient. Payment plans allow you to increase your patient retention, and they allow for an easier transition to wellness care, for example with chiropractic or dental services, or possibly even allow for an increase in the amount charged per session in the office. The big thing here is making those payments fit into the patient's monthly budget. If we can do this effectively, the total dollar amount billed to the patient is immaterial. The reason for this is that we live in a world with monthly payments. What does that mean? Well, we make payments to keep a roof over our head, for the car we drive, for our cell phones, utilities, cable bills. The vast majority of the products and services we use or consume are via monthly payments. It is essential that we speak the patient's language, and what I mean is offering payment plans for your care. Prepayment or paying in one large sum isn't even an option for most of the patients nowadays. In my experience, 80 to 90% of the people who are walking into my office were interested in a payment plan. Just take a look at some of these facts. Most Americans are living from paycheck to paycheck and have less than $1,000 in a savings account. So how do you expect the patient who's walking in your door to pay $2,000, $3,000 or more for a treatment plan? It's just not going to happen, unless they can space it out over a period of time. It used to be really easy to get credit financing. I remember a time when I would get 3 or 4 pieces of junk mail in one day, offering new lines of credit. Nowadays, more than 70 million Americans have FICO scores below 600, and anything below 640 disqualifies them from traditional financing. So it's no wonder a majority of the patients are being turned down by Care Credit and other medical credit cards. Now, by being a client of PPS, you're staying one step ahead of the game, so use it. Because now you are able to accommodate the millions of people who otherwise wouldn't be able to receive your valuable services. So here's the big question: how can you make more money by offering payment plans? And really, no matter what type of provider you are, there are 4 ways to bring home more money. Number 1 is to increase your conversion rate and have every patient that walks in your door accept your proposed care plan. Number 2 is to have your established patients stay longer or be seen more frequently. Number 3 is to increase the dollar amount that you are charging for your services. This can be harder to do than the other 2 options. However, you may consider raising your fees because the total cost of a product or service is less important than making a product or service fit within a patient's monthly budget. Think about buying a car as an example. Buying a car for $40,000 to $60,000 isn't a big deal anymore, even if that is the equivalent of an entire year's salary. The important part is that that car payment fits within the monthly budget. The fourth way to make more money is to decrease write-offs. Now, I have a friend who always says that it doesn't matter how much money you make, it's how much money you take home. And there is definitely a certain amount of truth in that. And one of the biggest mistakes that providers make is writing off nearly 50% of every dollar billed to the tune of $65 billion in 2010. Now, the beauty of the PPS system is that we help you in all four of these categories. With just a small change in each of those categories, a big jump can be seen in the amount of money that you are taking home every single month. We tend to focus all of our attention on bringing in new patients. So in this example, a 50% improvement in the number of new patients translates to a 50% increase in income. Now, if you were able to see a 50% improvement in the new patients that you convert, a 50% improvement in the retention, the number of times the patient visits your office or PVA, and a 50% increase in the cost of an office visit, your office visit average or OVA, you would increase your income by a whopping 338%. You would go from $2,800 per month to almost $10,000 every month. You guys get the picture? Now let's talk about some of the mistakes that providers are making, and we have already touched on this one. Mistake number one is simply not offering affordable payment options that fit within the patient's budget. This one is pretty obvious. If the patient can't afford treatment, they're not going to do your treatment. It's a missed opportunity. Mistake number two is not automating payments. I think a lot of providers understand the need for payment plans, but possibly don't know how to implement them effectively. And as the saying goes, money is in the details. The goal with setting up a patient on an auto debit payment plan, like with the PPS system, is to limit the association that the patient makes between you and your services and money. Let me restate that. Basically, the less the patient is reminded that you and the services you provide are taking money away from them, the better. If every time that patient comes to your office, they are pulling out their wallet or their purse, it won't take long before they're feeling pain. The pain of knowing that the money they are handing to you could be spent on other shiny stuff that probably brings more pleasure to them than you do. Do you follow me? A pay-as-you-go plan is the absolute worst thing you could be doing from a business standpoint, whether it's a patient who has no insurance coverage and is paying for everything out of pocket, or a patient who does have insurance but is paying, say, a $25 copay. The outcome can be the same. That patient will disappear a lot sooner than if a payment plan was arranged and automatically being deducted from an account of their choice. In my opinion, the PPS system is an even better option than the Care Credit or other medical credit cards out there. And the reason is the same as we just discussed. Every time that patient receives their Care Credit statement in the mail, they are reminded that you cost them money. However, when we auto-debit their accounts, we are just one transaction out of many transactions, and the patient is a lot less likely to make that negative association between you and the costs. They're a lot less likely to feel the pain. Mistake number three is not outsourcing your accounts receivable and collections management. Luckily for you, by choosing to use the PPS system, you are not making this mistake. Mistake number three, in a sense, is related to mistake number two, in that it is important for the patient not to have negative feelings in regard to money and your office. It is the provider's job to be empathetic and caring and be a positive supportive system in the patient's life. So it is no wonder why that relationship can be damaged frequently due to financial matters. By distancing yourself and having a third party collect money on your behalf, like PPS, the provider is better able to focus on providing quality health care, while we get to focus on increasing your rate of collections. So stop. Stop leaving your money on the table. And it truly is your money. In my humble opinion, I believe that things happen for a reason, and I believe that every patient that walks in your door is meant to be there. Everybody wins. The patient receives the care they need and isn't overly burdened financially. You get the satisfaction of providing a valuable service to the patient and strengthen the financial health of your practice. So start offering the PPS system today and watch your practice grow. We are committed to your success and look forward to being a partner in providing cost-effective healthcare. Have a great day.